The first question was the proportion of Scottish dependent drug users that become drug-free on the basis of treatment. It is actually shockingly small. And the studies which my colleagues and I have carried out in Scotland show that after nearly 3 years of treatment, that's less than 1 in 10. So after nearly 3 years of treatment, 90% of people who've had substantial exposure to drug treatment are still continuing to use illegal drugs. Now, you compare that to the 80% of doctors who become drug and alcohol free on the basis of the treatment that they have, and that treatment substantially was actually 12-step abstinence-based treatment, and that's discomforting. So how come 80% of doctors can achieve become drug-free, and less than 1 in 10% of drug users in treatment in Scotland can become drug-free? And in part, I think it's because they're in programs which are exhorting them and encouraging them and supporting them to become drug-free, and that is not the experience of most drug users in Scotland. They are not participating for the most part in services that actually prioritise becoming drug-free. They don't have the resources, the financial resources, the emotional resources, the social resources, but the doctors do. And it may be unrealistic ever to expect that 80% of Scotland's heroin addicts are going to become drug-free on the basis of any treatment offered consistently over time. But I think that we cannot comfort ourselves with less than 10% after 3 years. That is so
miserably, my answer to my question?
That is so miserably low. We have to change that.
My